In this video, I'm going to show you 10 exercises that can help you to reduce scoliosis in your body. And we're going to go through each exercise. I'm going to talk about a strategy that you can use for approaching these exercises and any other exercise that you do. I'm just going to use these as examples for teaching that strategy. And the exercises are going to get more complex as we go through them. And I did save the best for last, the most important ones for last, so you will understand this technique before we get to those. So here we go. Let's get right into it. This is probably the most obvious one. It's going to be side plank. So scoliosis is a side-to-side imbalance, right? We're going to try and restore balance in your body, left to right. That requires trying to strive for equal amounts of strength and flexibility on both those sides of the body. The side plank is a really great exercise for strengthening the lateral sides of your core. So the strategy that I mentioned is going to be basically you do a test on each side to figure out which side is stronger or which side is easier to do the exercise, or which side you have more endurance. You're able to do it longer with better form. And usually that's going to be one side over the other for all three of those things. Then after that test example, you are going to do another round and you're going to spend more time. You're going to focus your effort on the side that is weaker or harder to do, or you're unable to do it for as long as the strong side. So this is another exercise I've switched to, and it's basically kind of like a yoga pose, and it's now not just strengthening, but stretching the muscles on the left and right sides of your body. So I do my test round, I do left side, and then I do right side, and I compare which side feels tighter, which side, maybe with scoliosis, if you have an S-curve scoliosis, you have tightness on one side up high, but tightness on the other side down low. So that would be common with S-curve scoliosis. And so this exercise, this is basically similar to a warrior pose in yoga. You can see me running my hand down the side. So that's where I'm feeling the stretch. Maybe it's up high on that left side that I'm stretching, but down low in my hip flexor on the right side. So I'm going to sink into those stretches on the relative side. Now here is our third exercise. I told you we're getting into increased complexity as we go through these exercises. So this is not just strength or flexibility. This is joint mobility. This is hip mobility. So right now I'm working on my right hip, and you don't need to know how to do all of these exercises to achieve the goal. These are all exercises that I teach in the Core Balance Training Program. We go into detail through all of them, how you should be driving your motion through them. But this strategy really just applies to all unilateral or one-sided exercises that you do. If it's an asymmetrical exercise, meaning like not a squat, not a deadlift, but you're doing left side and then doing right side, it gives you an opportunity to compare and then work more on the side that needs the work. So we're dealing with strength, we're dealing with range of motion, flexibility, and this exercise is a little more complex. It also involves balance. I did a video recently where I showed a really valuable exercise where you stand on a piece of wood 1 inch thick and you dropping your pelvis. And in that video, I said, this exercise is really good for scoliosis, but it's not the only thing. You need to hit it from all angles. You need to hit scoliosis in all different planes. And so now we're operating in a different plane of motion. This is no longer the sagittal plane, this is the frontal plane. We're moving side to side, getting some hip mobility and also leg strength as I shift my weight over to one side. And I'm able to compare left to right. So this is the strategy. First, you compare. Once you identify which side needs more work for that exercise. So remember, every exercise might be a little different. You work on that side that needs more strength, that needs more flexibility to catch up to your strong side. Now, this is an extremely complex exercise where I'm working on not only balance, but hip rotation in a transverse plane. It's a very unique exercise. There's not a lot of opportunities to challenge the hips and the core and basically all the way up and down the chain of the body in this way. So I'm working on hip rotation right now, but it's extremely challenging for me to keep my core engaged and my balance. So again, you don't need to know how to do these exercises. These are very complex exercises, but you do need to understand is the strategy that I'm applying. So I'm working more on the side that needs the work. Basically, the side that I don't want to work on, because we love going towards our strengths. So back when I was struggling with back pain for over a decade, I loved doing pull-ups because I was really good at them. So I did lots of pull-ups, but I was really bad at some other things. And those are the things I actually needed to work on. I didn't need to work on pull-ups. So work on the things that you're not good at to achieve balance in your body. And that includes working on the side that you are not very good at, the side that you're not very strong at. So this is a single leg squat. And I'm doing my right leg now. And now I'm going to compare and do it on my left leg. This is an advanced exercise, but you don't need to be able to do a single leg squat to apply this strategy. So my left leg is weaker. I already know that. So I don't have to do the test every time. Now that I know my left leg is weaker, each day, each time I go to the gym, I can just focus more on that left side until I even out my left and right sides. And we're hitting that scoliosis, that pelvic tilt or that imbalance from all angles. So now these are the exercises I said are going to be the most important ones. These are extremely common exercises. This is a variation of, leg lifts or leg lowering exercise, similar to dying bug or dead bug in a physical therapy clinic. But the reason that this one and this next one, which is commonly called bird dog, are so important is because they're specifically training the core, targeting the core muscles, because scoliosis is ultimately an imbalance in your torso, in your axial skeleton, the spine, and the core is what surrounds that. So you need to compare left and right sides. And yes, these exercises are extremely common, but it's not about just doing the exercise. It's about how you do the exercise. And the point I really want to drive home here is it's really critical how you are engaging your core during this exercise. So it's not just about going through the motions. It's about the quality and the form of how you are using those core muscles. How do you engage your core? And so this is another one. This is the most valuable one to address a really common imbalance around the pelvis. And this is the single leg bridge. Okay, so we're really strengthening the glutes and the muscles, the hip extensors that really support the pelvis. And I can easily find an imbalance between my left and right sides, depending on how long I can maintain that single leg bridge. But again, core engagement is by far the most important thing. So it's just not about just getting on the floor and going through the motions of the single leg bridge. It's about the quality of how those muscles are engaged. And if you don't know how to engage your core, if you're not confident about that, that's exactly what we teach in core balance training. We spend the entire first module working on a really healthy core engagement and nailing that down as the foundation before you move on to adding complex movements to that core engagement, which just challenge that skill that you've developed and make you better at it. So the foundation is how do you engage, And everything else you add, all those complex, fancy movements I was doing, are just challenges to that engagement, which you want to be balanced left and right. And also, we do offer that first module that teaches core engagement as a free trial. So you can get that whole module for free and learn that core engagement and then apply it to any single leg or unilateral or asymmetrical exercise that you do and help to restore left-right balance in your body. Hopefully you found this video helpful. If so, support our channel by hitting subscribe, and I'll see you in the next one.